this year alone, just like you said, there have been two major strikes. Talk about April 1st and August the 2nd, 2021. And this is coming, just like you said earlier on, that amid the Delta variant of the coronavirus, which has made inroad into the Nigerian health space. So on whose table would you say the buck stops? Because the federal government says the matter is for the state government to solve, while the state government says it is for the federal government to solve. So on whose table would you say the buck actually stops?
The bulk of the demands being made, I can tell you that the federal government has to address. When you talk about irregular payment of salaries of doctors, I know that some states are guilty of that. We have what ASU described as proliferation of state universities. And these state universities also have teaching hospitals. Now, medical workers in some of these state hospitals, state teaching hospitals, are not being paid regularly. You cannot blame that on the federal government. But the issue of hazard allowance, for example, there's no way the federal government can say that it's not at fault. The issue of IPPIS, for example, they are saying let's have minimum enrollment of doctors into the IPPIS. You can't also blame the state governments for that. The issue is the federal government must lead the way. It must begin to pay the hazard allowance that it promised to pay. They've already lost 19 of their colleagues to COVID-19. These guys were lost while trying to save the lives of our people. So a person gets paid 5,000 naira hazard allowance to put his life on the line, to try to save other people's lives. How do you motivate people to put their lives on the line for that paltry sum of money? And this is the reason we are unable to keep our doctors here, because the operating environment is too toxic for doctors. Some of the equipment that they need to do their work properly are non-existent. Yet in this same country, we have the great UCH, University College Hospital, where Saudi princes and some of their cousins in inverted commas in the UAE and Lebanon used to come and have their medical tourism many years ago. But we have regressed. Who still leaves his country to come and seek Medicare in UCH at this time? So we have really declined, and I think that a lot of these problems can be solved if we change our attitude, if the government begins to invest sufficiently in the health sector, increase the quantum of money that you set aside for health in the budget.
Right.
Just look at what we set aside for health in the budget every year. You know that we are not a serious nation. If we can do that, then we should be able to pay good wages to our medical practitioners. Then a lot of them who are running abroad will then feel like staying here.
Your point is actually made. You made a very fantastic point there.